Next, we invite Dr. Prakhyat Roop, who talks about an ageless phase matching technology to achieve true panfocality, which is in a natural lens. Dr. Prakhyat, everyone knows about him. He knows the physics and he knows the aberrations where we learn from him. Dr. Prakhyat.
Hi, good morning, afternoon, everyone. So I'll be speaking about the edgeless phase matching technology, which is the new kid on the block. If we consider the optics of IOLs in presbyopia correction, then this is something which is drastically different from what we know, which is either a refractive or a diffractive optics. So I'll start my talk by introducing it in this way. My top 3 concerns as a clinician while using a presbyopia correcting IOL is number 1, what are the visual side effects of this lens? So what is the extent of starburst, glare, halos, waxy vision, ring shadows, ghosting at night time? What is the extent that the patient is going to experience this? What is going to be the range of vision? So reliably, how much spectacle independence am I going to give to the patient? And third is the compromised quality of vision. Distance vision is the most important factor for patient satisfaction after cataract surgery. And if that is compromised, then the patient is usually unhappy. So right now we are stuck between the 2 choices. Either there is an EDOF lens or a trifocal lens. In an EDOF lens, we have the advantage that it has less symptoms of night driving and glare, halos, etc. are low. It does give spectacle independence, but only to a limited range. And it has minimal loss of contrast. So clearly it is the choice if we are looking at a lens which has good tolerance. But if we look at a trifocal lens, it has excellent range of vision and spectacle independence is truly there. But the problem is in the quality of vision and is in the side effects. So the question arises, why do trifocal or multifocal IOLs have these side effects, which is pushing everyone towards EDOFs? So the answer lies in this patent that was filed in 1998. Which shows that the steps of diffractive IOLs are the cause of side effects. So what this patent says is that light incident from an off-axis point, which is not aligned with the principal axis, when light is coming at an angle, it is incident on these steps and scatters at these steps. This scattering increases with increasing angle and increases with increasing step height. And to address this problem, what we can do is we can align the light parallel to these steps. Or we can coat these edges with optically opaque material to do away with the side effects. And this has been tried multiple times since the very first apodized diffractive lens, which actually reduced step heights as you go to the periphery to ameliorate the perceived glare or halo or rings around a distant discrete light source. This was around 14-15 years back. Then there has been attempts to reduce the number of steps. And then there have been attempts to reduce the step heights also. So the question is, what was the need for these steps? The need for these steps is to basically match the phase of light to baseline, which is essential for constructive interference or for diffractive optics to work in simple terms. But the side effect is obviously this unaccounted light loss. Now the question is, why do we not discuss this light loss? We have been using lenses for so long. No company has ever given us a data about the unaccounted light loss that is happening. The reason is that the data comes from an optical bench where the light comes parallel to these steps. So you never know exactly how much light loss will happen at these steps in real life when it is in a patient's eye. Because in real life, the situation is like this. Light is going to come in a slanting way and going to undergo multiple optical phenomena at these edges. And these phenomena are going to be unaccounted. So this light is not reaching any useful focus. Naturo is one lens where we have 0 steps. So there is absolutely no steps, but the phase matching is still there. So that is why it is called the edgeless phase matching technology, where a negative kinoform phase matching has been done. Now what does this mean? If you look at the base curve, which is the top, and the second conventional kinoform profile, and you add both of them, you fuse both of them, you will get a conventional bifocal diffractive lens. If you use a negative kinoform with the base curve, you would get a lens which would have a base power and a minus power as a second focus. So it would be like a 20 diopter lens with a negative add of 2. So 20 and 18. Now if you match both of them together, you would get something which is called the L-max profile, where you can eliminate all the edges of the diffractive optics. And I was not convinced by what was told to me, so I have actually gone ahead and did multiple studies with independent evaluators, including the University of Valencia in Spain and in Belgium, and I actually got the optical part distance of this lens analyzed and realized that it actually does diffraction and does work. So how does the L-max profile work? If you look at a conventional profile, then all of the steep edges of the blazed sawtooth profile, diffractive profile, are actually causing light loss. So if you analyze the whole surface and you stretch it out, then there are circles of surface area where the light, if falling, is actually going waste. In the L-max profile, there is no such area of light loss. So basically, the complete surface of the optical element is throwing light to a useful focus. And that is why there is no wastage of incident light and there is no ghosting or ring shadows. So this is the basic difference between the conventional diffractive optics or the trifocals versus the edgeless phase matching technology. Now, another thing that comes with diffractive optics inherently is the ability to actually make light distribute to different foci independent of the pupil. So you don't actually have to be dependent on the size of the pupil aperture to actually see the light efficiency. And this has been worked or tweaked in this live vision technology, which was awarded at the ASCRS in 2020, so that the lens actually slightly skews the light distribution in favor of the kind of work that the eye is doing at the time. So basically, we analyzed, and here some of input goes from our center and our study, where we analyzed the light conditions in different daily activities and analyzed the mesopic pupil size for the Indian population in those lighting conditions. And the light actually goes in such a way that if you go in the outdoor daylight in a small pupil, the lens is actually very close in performance to a monofocal lens. So the distance vision quality is not waxy at all. In the indoor ambient light, you get the 3 foci and a large area under the curve, as Dr. Kamal was saying. The wastage of light here is gone. So the advantage in EDOF used to be that you don't have any wastage of light. That advantage you get here with a complete range of vision. So it's a very disruptive concept. And if we look at the surface profiles compared to all the other trifocal lenses, you see that the profile is completely different, wherein the complete elimination of a steep edge is there. So there is absolutely no wastage, which leads to more light going to every focus. So the light loss from these steps is gone, and that adds to more clarity at each focus. We have done a study of around more than 500 eyes, and it shows that we get great range of vision. If we look from 100 centimeters onwards, then we see that the light is actually 6.6 or better at most of the foci, with no disturbing glare or halos. Ultimately, our chair time reduces, and we use this lens most often in our CLE patients. Thank you.
Thank you, Dr. Prakhyat.